I place my probe on the left side of the sternum, roughly at the third or fourth intercostal space. You will see that in ICU patient, it is usually easier to obtain the view from the fourth intercostal space. You are trying to aim at obtaining a view where the ventricular wall will be perpendicular to your M mode line, so that you can make measurements that are orthogonal to the walls, in order not to artificially increase the size of the cavity and the thickness of the wall. So, as I was telling you, the parasternal view, in order to be correct, needs to achieve three goals. We need to see first the aortic valve, we need to see the mitral valve, and we need to maximize the size of the left ventricle. It is quite easy, if you tilt the probe a little bit, you see, to have a small left ventricular cavity. You really have to aim for the largest possible left ventricular cavity. By doing so, I've rotated my probe, and you see, I don't see anymore the aortic valve. So I have to correct, so we can see the aortic valve again. So it's not so easy to achieve the three things at the same time. So you will have to practice. Don't get frustrated. It is very important to learn how to do that. Now, is it possible to activate the M mode here? I don't know.
M mode.
M mode from...
M mode,
just to show where we are. Yeah, thank you. So now I need to place the line of the N mode to make the measurement of the left ventricle. Correct, yeah, exactly. So you see we have to place the line orthogonal to the wall and just below the level of the mitral valve. So now we can activate M mode and we can record the motion of the ventricle with time and measure. We can stop the M mode, yeah. And this is where you're gonna make your measurement. We will do that during the hands-on this afternoon. I will show you how it goes. But this is as simple as that. Thank you. Back to the 2D, please. So, in this view, you can also activate the color Doppler in order to make sure that there is or not a large regurgitation on one of the valves. Is it possible to activate the color Doppler? Yeah, here is the window. So, color Doppler is very useful, but as soon as you activate color Doppler, you will, not on the simulator, but in real life, you will drastically reduce the frame rate, the number of images you get per second, because it takes a lot of calculation power from the machine. So if you have 50 images per second with the 2D, you have a very nice fluent motion of the heart. When you start the color Doppler, the number of frames per second drops from 50 to 25 maybe. The larger your color window, the more severe the drop in the frame rate. Okay? The more you want to map the flow,